It seems like Speaker Johnson has a thin line to cross here or to walk. He's reportedly ruled out a couple of the more controversial, more aggressive Medicaid proposals. But what do you make of that move from leadership? I mean, where do you think, do you have a sense of where leadership's head is at when it comes to Medicaid cuts, if they are happening?
So I think they were supposed to be doing this work in committee and marking up the bill this week. Obviously, that didn't happen. Now we hear it may take place next Tuesday or Wednesday when we come back in session. We'll see if that actually occurs or doesn't. Again, yeah, and then they've got a president who wants to pass this what he says is a big beautiful bill. It's a bill that's going to take healthcare away from folks in order to give tax cuts to Elon Musk and Jeff Bezos. We don't think that's going to be a winning idea for some of these more vulnerable Republican members of Congress. So I think Speaker Johnson's in a tough situation. I think some of these Republican members in more moderate districts are caught between what's best for my constituents, the people that I work for, versus what does Donald Trump want. And we'll see who wins out.
The nonpartisan Congressional Budget Office ran the numbers here, and they predicted millions of Americans are going to lose coverage depending on certain changes to Medicaid policy. So first of all, if millions of Americans are losing their Medicaid coverage, overall, what does that do to healthcare in the United States?
I mean, that's going to impact everyone. So again, we talked a little bit about what happens in rural communities, rural hospitals. You'll see community health centers that also rely on Medicaid, perhaps really stressed or close. Those patients haven't disappeared, so they're still going to go to the emergency room and seek care when they get sick. That's going to have a downstream effect for folks that may have fantastic health insurance, but when they get sick, they may find an emergency room that's overcrowded and have to wait a couple hours, get that care. So you can't take Medicaid away from millions of Americans and not expect that not to have an impact.
President Trump has repeatedly said on the record, most recently at a town hall with News Nation, that he's not touching what he describes as entitlements, and that includes Medicaid. Do you believe him? Because it sounds like you don't.
I don't. I mean, I think they said they want to cut $880 billion out of the energy and commerce portion of their bill. There's no way to do that without attacking Medicaid. And we know that, they know that. Now, they may do some things that are sleight of hand, saying, oh, we're going to reduce the reimbursement rate to the states, and then the states are going to have to pick up that portion of it, or they're going to have to cut back on benefits, or they're going to have to drop people off of Medicaid. It is good to see some state Republican governors push back and say, hey, don't do that, because we can't pick that up, and we will lose coverage. So, again, if they follow through with this, if they pass this bill, millions of Americans will lose coverage, and then they'll have to go back and defend that when those folks lose their health care and complain.
And I mean, I'm sure you've had these conversations before with your Republican colleagues where you're saying, hey, the math isn't mathing here. You've been tasked with cutting $880 billion. Something's got to give here. And that thing that needs to give is Medicaid. What do they say to that? I mean, what's their response?
I mean, we will add one. What they want to do is cut those benefits, take healthcare away from folks in order to give a tax break to the richest Americans, Elon Musk, Jeff Bezos, others. That's not a winning message. We're more than happy to, I wouldn't say meet them at the 50-yard line. We'll go to their 40-yard line, 35-yard line, work with them on fraud and abuse, ways to improve the efficiency of healthcare, hopefully reduce the cost of healthcare. We're in that with them. But taking healthcare away from folks is not a winning message.